Welcome to the MHS Podcast Live. My name is Guy Danhoff, and I will be your host for tonight's podcast. Boy, do we have a big podcast for you. Tonight, we're going to be talking about school-based mental health resources, and I just can't wait to get started with our main feature guest, Lisa Dierking. But just before that, I want to let everyone know that what Lisa has done, and I'm so appreciative, is she's brought a few friends with her, and we're going to have some experts talking about 5 big resources that are going to be shared tonight. And so, why don't we go ahead and bring Lisa on at this time? Because I got to tell you, this is going to be a really, really big broadcast. And here she is. Lisa, how are you doing tonight?
Hello, I'm doing great. Thanks for having me.
Absolutely. All I can say is I cannot believe the cast you've assembled for tonight, the amount of resources. Obviously, mental health is a big deal. And so, why don't you give everyone a little bit of background about yourself? As I know that you're the coordinator of school based health for the Missouri Department of Elementary and Secondary Education, otherwise known as DESE. But kind of give us a little more background about you and your role.
Yeah, absolutely. So, this is a new position that was created. It was passed in the last legislative session. So, I am a new person at DESE, a new position. I started about 5 months ago, and my background is actually in social work. I've been in the field for about 18 years, and my passions are school based mental health and early childhood. And so, this is kind of my jam.
So, Lisa, with that, why don't you kind of bring us up to speed on what's going on at the state level, the district level, the school level, because right now everyone's always asking the question, what's the latest in mental health? What's going on with our schools? Maybe you could give that 30,000-foot view for everybody.
Absolutely. So, one of the things that I really want to touch on is we can't do this work alone.
Right.
And you're going to hear that theme throughout, and that's part of why I assembled the team that I have, because it's a team effort. So we are all in this together, and so there's a little bit of some data that we are going to talk about. So, there's something that came out called the YRBS, or the Youth Risk Behavior Survey. And there's some data that came out not too long ago. I think it was released last month. And some of the data that came out is our kids are hurting.
Right.
And so, yeah, so we can talk a little bit more about that. So kind of drill it down a little bit. So in
Right.
2021, 42% of our high school students felt so sad or hopeless for at least 2 weeks in a row that they stopped doing some of their usual activities. Nearly 60% of female students experienced persistent feelings of sadness or hopelessness. 18% of high school students made a suicide plan during the last year. And female students are more likely than male students to make that suicide plan. 10% of female students attempted suicide. And I was in a meeting today, and I heard another fact that, and this isn't necessarily about our youth, but 80% of suicide completers come from males. And so,
Wow.
it just a lot of those statistics kind of coming at you. And I know I went through them really quickly, but kind of the overall thing is, and when we're hearing about mental health in the news, and we're hearing about it from our friends, and but our kids are hurting. And so,
Right.
one of the things that I also want to touch on is, the research shows that one of the biggest protective factors that we can show is that one caring, supportive adult. So that's why, again, our schools are so important to this. And so, yeah.
So one of the things I want to show on the screen right now, maybe you could speak to it. This is obviously the resource for that data that you were talking about. And I was wondering if maybe you could talk just a little bit about the YRBS data summary and trends. And as we look through, like you said, it was just released, but if someone wanted to download it, they could go right here, correct?
Absolutely. And what I like about this one is it's a 10-year kind of snapshot of what's happening. And a lot of people are using this data for their infographics and kind of what's happening across across our state, across our world. So, yeah, so thanks for pulling the website up. Look at that.
Well, I thought it would only be appropriate. I mean, you're going to be talking about data. And I think the most important thing we want to do on tonight's podcast, again, as you said when we were talking before this all started, was we wanted to provide as many resources as possible. So with that, let's shift gears now. And I know that we have another topic that I want to get you to talk on, and that is talk to us about the new DESI update.
Yeah. So, okay. So, like I said, I'm kind of a big picture person. So, I
Okay.
told you this is a new position. So, kind of from the DESI world, we've had a position here in a section here called School Counseling and Student Wellness. And a lot of you out there may know Chrissy Bayshore. She's
Yeah.
kind of been in the field for a long time. And so, her and I are really kind of the dynamic duo here. And so, you're going to see a lot of that coming down from the top down, that partnership. And so one of our goals is to kind of break down those silos, create those partnerships across the state. Because if we can do that kind of at the state level, of course, we're going to see that again at the district level, at the school level. Yeah.
So, Lisa, as we're talking, we know that this is also grant season and there's some new initiatives. And I was wondering if you could speak to some of the grants, because I know there's a new one on the Immediate Responsive Services Grant, and that just closed on March 10th. But I was wondering if maybe you could kick us off and give us some insights on that grant.
Absolutely. So, one of the things that I've had the pleasure of being a part of is this grant. So, this grant was available to every single school district across the state, all and don't quote me on this, but 561 last I knew, 561 districts. And so, out of those,
Wow.
359 applied. And so, I'm going through those applications as we speak. And so, every single school district had an allocation amount that they could apply for. The minimum being like 23,200 or something like that. And it goes up based on a fancy little formula that we put together. And what that does is the goal is to increase student access to mental health resources.
Okay.
What does that really mean?
Right.
Well, we're going to hire school social workers, school counselors, school psychologists. You can contract with your community mental health agencies and resources. You can, so again, we can't do it alone. We're partnering.
Right.
You can extend your mental health people throughout the summer, because that's again another piece that's missing a lot of times is that continuation of care over the summer. Telehealth is an option, and so what I've seen as well is districts kind of started to get a little more creative in their application. So maybe they said we have all these things checked, but what we really need is this. And as long as it came within those allowable items, then it was good to go. And so I was really excited. One of the things that came across those, so there were 3 questions on this grant application.
Yeah.
What's your needs assessment? What's your plan? And what's your budget? And through that, those needs assessments that came across my desk, there's a lot of needs in across our state. And the way that they put their needs with their plan, with their budget was top notch. So that's been a fantastic, and it really allowed me to connect across with these districts. I've talked to a lot of people in the field with the counselors and social workers, but also at the top with the administrators. So.
Right. So I also want to let anyone know that's watching live, you can ask questions if you're watching this on the Missouri Healthy Schools YouTube channel. Go ahead, put it right there in the comments, and we'll pop it up for you. If you got a great question for Lisa, feel free to ask away. That's one of the cool things about being live. And so now, Lisa, getting back to the grants, talk to us about the Recruitment and Retention Initiative.
Yeah, so this is an initiative. So one of the things, of course, as I'm talking with the administrators that might call me and say, well, that sounds like a great idea, but where am I going to find these people to hire?
Right.
Well, that's the pipeline piece. We all know in mental health that, there is a shortage and we need more people. So this is kind of our way. This is one of many ways that we're trying to help that. So this is our school-based mental health recruitment and retention initiative, and this is geared for universities. And so there are 37 school-based mental health programs at the universities throughout the state at 24 universities. And so this initiative is geared for those universities to be able to apply. So what they can do with that is they can have tuition, they can apply. Again, there's an application they have to go through. But each school-based mental health program has an allocation of $15,000 that they can then say, this is our plan. This is how we're going to recruit more people towards school counseling, or this is how we're going to recruit more students towards school psychology.
Right.
And so with that, then they're going to be able to do that. And yeah,
So
exciting.
Lisa, with that, there's also now, right, the school-based mental health startup initiative and looking at development. Talk to us about that because, again, it kind of goes along with what you've been saying on the last two initiatives.
Yeah. So the first two, let me be super duper clear.
Yep.
First two, they're out, they're published. It's a go. This next one that I'm going to talk about is in development.
Okay.
So this one is in development. That means the ink has not dried yet. So, so this one, our goal is, and it's another initiative, and this one again is geared towards universities. And this one we have a little bit more money to play with, but this one is geared towards universities to have a startup. And so what we're hoping to do is to have some financial money towards the initiative for school-based mental health to have a startup program. So let's say your university wants to start up a school social work program.
Right.
You need this to do it. Well, then you're going to apply, and this is what you're going to, put towards it. Again, very much in the infancy of figuring that one out.
And then with that, how many schools would that impact?
So that one, all the universities. So the first one that I talked about, the recruitment and retention,
Yep.
that one's for the existing programs that are already going in the state.
Okay.
The second one, the startup, would be any university that would want to start a program.
Okay.
So maybe they're like, man, that kind of sounds like a good idea. I know we kind of need more mental health in the world, but man, we just need this to do it. That would kind of be the extra oomph to do it.
And Lisa, can that also be tied to research as well?
Not sure yet.
Okay.
That's a good question.
No, it's a great question. I'm only saying because I'm a college professor as well. And I know that's something that, I'm just saying that would be something of interest that I know some of my colleagues would find interesting is, hey, could we actually collect, research on that as we look into mental health and whatever that case may be. So I thought I'd ask the question.
Yeah. Well, and again, the goal of it is for both the recruitment and retention and the startup is to increase the amount of school-based mental health professionals that we have.
Right.
So.
Yeah. And then you got the assessment piece. And I know that that's the data piece that a lot of administrators want. It makes a lot of sense to me. All right. Talk to me about the last initiative, and that is about Stronger Connections grant in development. What is that?
Okay. So that comes from the Bipartisan Safer Communities Act. Stronger Connections grant. Boy, that's a mouthful. And look at me, I have it memorized. So that comes down. We, again, in development, that's going through the appropriations process. And we anticipate receiving the spending authority through our legislation process. But the goal for that one is to increase student access to Tier 1 school-based mental health professionals. So that one has some requirements. So it needs to be a competitive grant. It needs to be for high need LEAs. We've determined that that's going to be the ratio of students to mental health professionals. It's going to be competitive with poverty, chronic absenteeism. And we're going to, the uses are going to be included that they can do with it are hiring school-based mental health professionals, stipends for licensure, tuition reimbursement for certification. So let's say you have a person like a teacher, let's say, that's filling that school counselor role, but they're not a certified school counselor. Well, here's some money to go back and do that certification.
Wow.
And then also evidence-based professional development for those tier one uses. So again, that one's in development. It's a lot closer. We have it mostly written and ready to go. We're just waiting for that spending authority go button.
So what's it been like knowing, if you look at the last maybe really since COVID, right? Take the last 3 to 4 years, and now you're seeing really so much doubling down, if you would, on all these resources and grants. And, how does it make you feel in your position?
Oh my gosh, I feel like I walked into this at the right time. I mean, COVID, it's one of the things that we've come out of it that people are recognizing that mental health. Now, was mental health a thing before? Absolutely.
Yep.
I feel like it's getting the recognition that it needs. I went to a conference on the young years, and I was listening to a guy give a presentation, and we talked afterwards, and 18 years ago, when I was doing therapy in Arkansas, doing school-based therapy, going to these little bitty schools, it was not cool to go see your therapist come to your school
Right.
with their little pack with, all the little goodies in it, Uno cards and, story cubes and all the cool stuff. Whereas now it's not the stigma. Now, do we have a lot to go? Yes, there's still stigma out there, but it doesn't have the same connotation, the same stigma that it did 18 years ago. So I think those are some good things that we're seeing. So yeah.
Well, I got to tell you, I really appreciate you going through all of the grants and initiatives. It sounds like Missouri has got it going on, especially in that area. Talk to us about, I know we're going to bring on some of your friends, certainly some experts, but talk to us about the resources. And again, give us the general overview, because I can tell you, this is the first podcast we've ever done that is this rich in resources.
Well, yeah. So when I was invited to come on here, I was so excited, and I wanted to make sure we talked about resources. Anytime that I'm giving a presentation in a couple weeks at the administrator conference, and by golly, I've got my resources in there so that I can spread the word. But anytime that anytime I'm speaking or talking, I want to get the word out, because I was in the field for 16 years, and some of these things, it's the first time I've heard about them. And so I want to make sure people know about what's out there, and what's available, because we need to spread the word. And there's a lot of great things that are out there. We're only going to talk about 5 today, where I could have brought on 10 people. It would have been, yeah. Anyways, that would have been fun. So we're going to break, because again, it comes back to that theme.
Right.
And again, you're going to see that theme you're going to feel that from me, and anybody that's watching. I hope that you see that from anything that I do: partnerships, collaboration, breaking down silos over and over and over, because we cannot do it alone. So you're gonna learn a lot.
Look, I've already learned a lot just from checking out all the resources ahead of time. So without further ado, let's start with our first one. And this one is, I'm just going to be very honest with you. It's something that I can tell you. Earlier today, I talked to a colleague of mine that was dealing with a situation on this topic that we're going to, talk about. And we're going to bring on at this time Lauren. And Lauren Moyer is going to come on. And Lauren, if you could give us a little bit about your background and certainly the resource that you're going to talk about tonight.
Yeah, well, I just want to thank you both, especially Lisa, for recognizing that this is such a critical resource. So Lauren Moyer with Compass Health Network. So I'm our Executive VP of Clinical Innovation. And that's just a fancy way of saying I'm over our behavioral health services, as well as new initiatives and further development for our agency. But aside from my day job, I'm also our 988 State Task Force Chair and the chair of our Missouri Suicide Prevention Network's Suicide Prevention in Schools Committee. And so 988 has been definitely a hot topic, but I think it's a topic that we still need to continue to market and continue to alert our communities to. So 988 really is replacing the crisis line numbers. It is a quick and easy way that you can access anytime, anywhere, any place, 24/7, 365, if you are struggling with a suicide or any general behavioral health crisis that you might be having. And so for the state of Missouri, we really took an approach of 988 to us is so much more than just a number to call, than a person to answer the phone in the moment. Because we recognize that suicide and behavioral health crisis, it's not just a one and done type of situation. Oftentimes people are struggling with these thoughts for months, if not years, before they reach out for help. And so we really want to make sure that we have a open, no wrong door approach to get them into our crisis system of care and get them the help they need when they need it, where they need it. And so we put together, specifically, we wanted to target our school system. We know that our youth and our adolescents continue to have an increase in not only suicidal thoughts, but actual suicide attempts. It continues to be the age group where we see an uptick in actual suicide deaths. So we want to make sure that anyone who touches a child or an adolescent's life has the resources that they need. So we compiled a virtual 988 resource guide. That guide really kind of shares the purpose. It shares some data. It's really a call to action to our communities. So not just putting it all on schools, but this is truly a community-wide effort to be there for your loved one, to ask people, how are you doing today? It's okay to not be okay. Really kind of reducing and removing that prejudice that we have around not being okay. And it really is a quick guide to give our schools something to reference, something to implement, real time. What we heard from our school systems is that there are a large amount of resources, but because there's a large amount of resources, they often get overlooked, underutilized. In the moment when they ask someone the question, are you thinking of hurting yourself? Are you thinking of dying? It's really more about, as a professional and as anyone asking that question, there is a level of fear behind that. But it's not about asking the question. It's really what comes from the response, right? And not necessarily having the resources to access right away in that moment to get them the help that they need. So we really want to make sure that we're pushing out the right material, but the material that will open the door for our school systems, for our community, to make sure that people have access to the resources and the help that they need when they need it.
And Lauren, with that, thank you so much for sharing that. Wow, what a resource. What are some of the things that actually comes with the school's toolkit? And then who are some of the people that would be involved in actually using it and implementing it?
Yeah, great question. So we created a virtual toolkit for any kind of learning style. There's a lot of videos. It's a quick click through. There's access and links to actual safety plan forms. So from prevention of really just educating yourself as a school professional, with the PTA, what are the warning signs? What are the risk factors? What should I look for? How should I ask the question to my loved one about what they're struggling with? To actually intervening. How do I intervene? What is the kind of response that I will receive when I do have an intervention or I do ask the question? What resources will follow up with folks once they have shared this and have, an in the moment response? What else is happening? We know from research that most of the time, if people have to utilize the hospital system for a suicide attempt or really in hopes to restrict the access to actually killing themselves if they have that plan and that intention, the most critical time is after they are discharged from the hospital. The most critical time is making sure that they get follow-up care so that they don't fall through the cracks. Because oftentimes, if you do go to the hospital for something like that, it is a stabilization and in the moment help, a distraction, but it doesn't help really tackle the issues that are triggering this crisis situation. So it's really about making sure you get linked and followed up thereafter and continue to have the discussion. And what we've found, especially with our youth, having done multiple focus groups with them, is that they really are struggling to talk about it because they have it kind of ingrained in their head that it's not okay to talk about it. So we as a community really need to chip away at that prejudice and that stigma and make it okay to not be okay.
Yeah, Lauren, I want to ask you a follow-up question. I recently, actually it was a year ago, but it was the first time I got very familiar with some of the toolkit resources. And one of the questions that came up that I'd really like you to talk about, because I want to piggyback on what you just said, and that is, what would you say to parents that might be viewing or even viewing the replay right now, that so that all kids know that there's a safety if you know of somebody, right? Their friend tells them, and is it okay if they call the 988 number? I was wondering if you could speak to
Yeah.
that dynamic, because that is something, the peer pressure, what to do, and you certainly don't want to be that person that didn't make that call when you should have, right?
Yeah. A large majority of calls that we receive on 988 every day, being a 988 crisis call center ourselves, are information only calls, resources, loved ones reaching out for tactics, the best way to, talk to someone. And you don't have to necessarily call. You can text and chat 988 as well. And so it really can give you that guide, and it can connect you to a mental health professional that can come to your home and help assess further if that's the case. Our whole goal with 988 is really to divert from unnecessarily having to go to the hospital,
Right.
unnecessarily having to engage police. We really want to focus on a very trauma informed response and the least restrictive response, so that gets the people the help that they need. So absolutely reach out. We can help give you the exact talking points. And when in doubt, like I said, just reach out.
Absolutely. Lisa, anything you want to add?
No, I think she did a great job. This is one of my favorite. I mean, they're all my favorite resources, but this is the one that I get a lot of schools reaching out saying, what do we do? What do I do? And this is the first thing, autopilot, send. So thank you so much, Lauren. You did a fantastic job.
Yeah, Lauren, thank you so much for joining us tonight. And I know that we're reaching out to you for further on some of our future podcasts as well, because what a resource and wealth of information, and really just the way you talk about it. I think, again, it's one of those topics that can be difficult conversations, but obviously you're breaking down all the barriers. You're using all the modern technologies at your disposal, including texting, which kids love to do.
Yeah.
Right? I mean,
adults love to do it.
No, I know, but
answer their phone anymore.
Yeah, exactly. I mean, seriously, what a great resource, Lauren. Thank you so much for being on tonight.
Yeah, thanks for having me.
All right, Lisa. Wow, here's your first resource right there. Lauren Moyer was in the house. I got to tell you, wow, that was pretty amazing, and all the resources in the toolkit. I got a sneak peek at that, like I said, last year at the nurses conference, and I just was so blown away. The signage alone, and all the different things that schools now can do, and the conversations you can have, and you can text that. What a great resource. So with that, let's shift gears, and let's talk about the youth mental health first aid. And we're going to bring on our next guest, and that's going to be, we're going to bring on Amy. And as long as I can find Amy.
And this is another one of my favorites. This is something that, so with my grants, whenever I sent out hey, we're extending the deadline, these are the resources that I put in my email to all the superintendents that said, hey, we're extending the deadline. By the way, here's some awesome resources, and this one's free. Sign up.
All right, let's bring her on. We've got her on. We got Amy Bortles with us. Amy, talk to us a little bit about your background, because again, I know that this is also another big resource that I think our viewers will love to hear about.
Yeah, absolutely. Thank you so much, Guy, for having me. And oh my goodness, Lisa, this is so much fun, isn't it?
I know, right? It's like phone a friend.
All the information at your fingertips. Here you go. Well, my name is Amy Bartels, and I am the program manager for mental health first aid in schools. I've been a mental health first aid instructor since 2018. I've been with this group for about a year. Prior to that, I have background in social work and human development as well, and been out in the field, out and about with the system since 2010, so for a number of years. But our group, so we are actually housed at the Missouri Institute for Mental Health on the UMSL campus. So we're under that umbrella. On behalf of the Department of Mental Health, we brought Missouri and Maryland actually brought mental health first aid to the United States back in the early 2000s. So we're really excited to be kind of one of those front runner states that opens up this program and this training for individuals. So I would love to just chat as long as you'll have me about all things mental health first aid.
All right. And you want to talk to us about this resource?
I don't actually, because that's going to be our next guest's resource, but I will, I could muddle through that slide if you'd like.
No.
What I would love to talk with you about is our good friends over at DESE have decided since last year in April to offer this opportunity for school districts to take mental health first aid at no cost to their district. So there's a cost associated with the program. We're offsetting those fees, which is super exciting for schools to get on board. Mental health first aid is actually a skills-based training. So it's not one of those sit and get, there you go. There's our website and where schools can sign up. It's not a sit and get type of a training. This isn't a click on the webinar and listen and do other things at the same time, but it's really a way, just like Lauren was talking about some of those hard skills, asking the hard questions about suicide, knowing how to navigate those conversations. Mental health first aid is a training that helps folks to understand and recognize signs and symptoms of an emerging mental health concern, and within the safe setting of that classroom environment gives you the opportunity then to practice those skills. So we've got actually two foundational programs. Adult mental health first aid is for adults that interact with, maybe this is someone that you work with, other adults, family members, people in your community. And then youth mental health first aid. A lot of schools opt to take youth mental health first aid because this is, again, geared toward an adult audience. But its focus is young people that are struggling with a mental health concern. And so it's recognizing what's the difference between typical adolescent development and behavior and what is a sign of an emerging mental health concern. And so mental health first aid is it's a day of training. It kind of varies in the format. Those kind of hours of training vary in the format that you select. We offer it in an in-person, a hybrid or a blended version, and then in the in-person training as well. So schools can choose the way that they want to take that training. But you might be thinking, well, I'm not a school. I'm not associated with the school. I'm just a person in the community, but boy, I'm sure interested in getting on board with all of this talk about mental health. We have a class for you as well. So you can find those on our website, mhfamissouri.org, and you can search for, we've got over 500 instructors across the state that offer courses all the time. We also post free open to the public courses on our website as well. And so you can find those and that information. Since our DESE initiative, since it's kind of what we're talking about today, we've provided over 100 courses for schools. We've trained over 2,600 school staff and teachers. So when we talk about how we're helping the youth in our communities, in our areas, and across the state, providing just that one trusted adult, we know that that can be one of those protective factors that helps a young person through a lot of these difficult topics and conversations that we're having.
So, Amy, one of the questions that I want to ask you is, it's really impressive the amount of training that's being done and the impact that's being done. Is there any kind of success stories that you can share, or maybe any data you've collected, anything along those lines?
Yeah, absolutely. So we have had, like I said, over 2,600 teachers, school staff, administration that have jumped on board and said, we're going to train our whole district. We had a couple of districts this summer, really more than a couple, handful that trained not only their whole district, but said we're gonna reach out and we're gonna bring in our food service staff. We're gonna bring in our transportation, and we're gonna offer this course because we know that those folks also have eyes on our young people. So really exciting stuff, and this opportunity is available, like we kind of showed with the website, available for schools. What we do is let schools sort of pick the date with their professional development date that works best with them, and then we partner them with instructors. There's also an option if a school, is a particularly large district, and maybe they say we'd like to train our own instructors. Well, we do that too.
Wow.
This evidence-based course, so there's lots of data and research behind it that backs what we're training. We give folks an action plan or a list that they can use, some tools that they can put in their toolbox. ALGEE, ALGEE. So we talk about assessing for that risk of suicide or harm. We talk and teach folks how to listen non-judgmentally. A lot of times we think we're a good listener, and then that non-judgmental piece can be the really hard part to put that together. And then giving reassurance and information. So it looks a lot different than advising someone, but giving that real reassurance and information. Information can look like 988 or some of those resources that we're talking about here today. And then encouraging appropriate professional help. Sometimes that's the path that a person needs to take in order to get on that track toward wellness. And sometimes it looks like encouraging self-help and other support strategies. And so we really have opportunity in the course to practice those skills, to sort of open up having that conversation with someone and looking at just ways to really be a support to those around you in your community.
And so, Amy, my follow-up question is this. We're not just talking about the Springfield school districts. We're not talking about St. Louis. We're not just talking about Kansas City, right? These bigger school districts. You're talking about any school anywhere in Missouri, correct?
Absolutely. Absolutely. So with the DESE initiative, obviously this is directed at K-12 public and charter schools in Missouri.
Right.
But as part of our initiative, we are absolutely open to helping other schools take advantage of this opportunity as well. So those, private schools, parochial schools, those, situations.
That's exciting. And it's really exciting, again, that the amount of impact that you've had already. And just I should have asked you this beforehand. So I'm throwing a softball at you. There you go.
Oh boy.
But how often do you update the material? Because I know sometimes that's a big question. How often do you update that?
Fantastic question. Yeah. So in 2019, we went to the National Council for Mental Wellbeing, sort of houses all of the curriculum updates and those types of things. Extensive research goes into test piloting, all of that. But in 2019, underwent a significant revision, which coincided really nicely with COVID. One of the outcomes of that, I know, look at all these outcomes from a global pandemic. But one of the things that happened out of that revision was this opportunity to offer the course virtually, which means that, no longer does someone now we still do offer it in person.
Right.
And like I said, we offer that blended as well. But that revision took this from a multi-day training down to a single day training, which makes it, again, more manageable for folks. And the real goal is we want to get this information in people's hands,
right?
So that they're able to then, notice, like I say, put on those noticing glasses and start that conversation and give people hope. So.
Amy, we want to thank you so much for being here tonight. Again, another wealth of information and resources. Lisa, I got to tell you, you got like an all-star lineup tonight. I mean,
isn't it awesome?
One right after the other, bada bing, bada boom, right? That's what I'm talking about. So, Amy, thank you again for being on. And
absolutely,
thank you. Awesome having you. And we'll, again, same kind of thing. I know that we'll be looking to use these resources in future podcasts. So good thing I got your information. We'll see ya. All right, Lisa, what can I tell you? You're just, wow.
I know, right? It's some cool stuff. Well, and I can't remember if she said it or not, but I think she talked about the two kinds, but there's another one, which is teen mental health first aid, which is where the actual students learn about it as well, which is kind of awesome. And just to think about this training as like the CPR of mental health, which is just an easy, cool way to think about it.
Well, that's kind of what I picked up on, and that's why I asked that follow-up question. Like, this is for like literally any school district in the K through 12 and parochial. And so this is great. I know our next guest and our next resource is something I found very intriguing because of being a parent of a high schooler. And I want to bring on our next guest, and that's going to be Brad Anderson. And Brad, first of all, my friend, thank you for being on tonight. And give us a little bit about your background, as you are the director of this resource known as the Parent Link.
Can I just go back to the queue? This is so interesting. I want to keep listening. I'm so excited that Lisa's in place, this important new position. It's so necessary and so needed. It's been needed for a long time. So it's just fun to be a part of this. My background, I have a couple of decades in youth development. Worked with 4-H in the county, state level. I was on loan to the military to work with 23 Army installations for a while on positive youth development techniques. So it's kind of fun to be back in a place you never thought you'd be, doing something you've never done before. So at a certain age, you stop getting to call yourself the new anything. And I can call myself the new director after 2 years now of Parent Link, which is really a pretty exciting place to be.
So talk to us about your resource, Parent Link.
Sure. There's always these standard definitions you throw out when people say, what is Parent Link? But I prefer to think about it in terms of a flower. If child rearing is a flower, we know that research identifies some key developmental nutrients that can really help caring adults put young people on a thriving path. We also know that every family has greatness, every family has strengths, but sometimes there's toxins in the soil that can really stop that flower from reaching for the stars as much as they could otherwise. And those toxins may be things like malnutrition, neglect, unmet healthcare needs, domestic violence, continuing trauma, isolation, all these adverse childhood experiences that really get in the way of growth and positive mental health. So when they say, what is Parent Link? I say, well, Parent Link works to detoxify the soil because we want those developmental nutrients in the lives of children to do their developmental work. When we say detoxification, what's that? Well, it's like evidence-based information, prevention strategies, early detection, peer support networks, anything you can do to reduce the impact of those adverse childhood experiences, those ACEs that are really already in place sometimes, but you want to try to, fix problems while they're at their most solvable, prevent them before they come, if at all possible. And we work with the experts on every child, which is the parent or the caregiver of that child. They're the experts. They're the ones that know that child best. We go about this in a couple of ways. Number one's the warm line. That's kind of our front door. And that's a statewide team of master's level professionals. They've got master's degrees in things like human development and family science, counseling, psychology, and various other disciplines. But we really pride ourselves on no question being too small and no problem being too big. We love the questions that come in and say, why is my child biting? Or I see my kid doing this. Is this normal? Because we're also going to get calls at 3:00 on a Friday afternoon saying, we've been evicted. I still don't know where we're going to sleep tonight. Here's our location. Can you help? One thing that I'm really proud about with Parent Link, among other things, is that we're really trying to be available when they need us and how they need us. So 8 a.m. to 10 p.m. during the weeks, noon to 5 on the weekends. There's an 800 number. But if you're like me and you don't like the phone, there's a text option. You can send it through Facebook Messenger. You can email. There's all sorts of ways to reach out to Parent Link. The warm line was our first way we go about this. The second way is our navigators. And we know that there are barriers in this world, and where you live, and a lot of other things can be determinants sometimes of what kind of barriers you face. Transportation's a barrier oftentimes. Not being able to fill out a job application can be a barrier. And so the navigator's job is to really help people get across those barriers and connected with those services and supports that are already in place for them. We're not trying to create something new. There's some great resources out there. We're just trying to help families get there because that's what those resources are there for. Those could be things like SNAP. It could be things like Medicaid. About 54% of the navigators work helping get people connected to Medicaid, and we have access to be able to tell them if they're eligible or not. A lot of times people are misinformed and told, nope, you don't qualify. Then why can't you afford to do your laundry? So that's important. And it's also really important to just know that there's somebody out there who cares, and somebody out there who's going to provide that listening support. So when people call, a lot of times they're embarrassed, they're mortified, they can't believe they're in this situation, they're mad at themselves for not really knowing the answer that they think they should know. And so it's kind of shocks them when they talk to somebody, they call the warm line, and they're met with somebody who's kind and who's not judgmental, who treats them like a person, and who values them as the resource that they are. And sometimes you just need that person, somebody to tell you, somebody qualified to tell you, you've got this. You're the best person for this job. You're doing a great job. What you're wanting to do is absolutely excellent, and we're going to help you get to that next step. And maybe we can help you problem solve how to get to where you want to go. So there is no cookie cutter, one size fits all solution.
Right.
These people on the warm line are going to find out what is your family's unique situation, what is it you're trying to accomplish, and then what specific vetted resources will be applicable to you to help you get where you want to go. This is so important. I mean, we know that there's no larger population of people with unmet mental health needs than children and youth. About a third of people in poverty are children and youth. We know that about 1 in 5 kids are going to meet the criteria for a mental health disorder at some point in their childhood, and 80% of them probably won't receive needed services. So this is huge. And if I can, I just want to read a letter we got recently.
Okay.
Just really briefly. And it goes on to say, thank you for checking in with us. It talks about their daughter finding a new job. So I just want to thank you for everything you did for me and my family. You gave my daughter hope for a fresh start with her new job and my grandson's well-being. Sometimes people don't know where to go for help and often get treated like just a number, but you did not treat us like that. And I'm eternally grateful because we're ready to get started, and we'll keep you posted on how things are going. So if you look at, some of the research suggestions out there, Search Institute has some great suggestions for how organizations should work with people that has real mental health ramifications. And they talk about focusing on nurturing relationships with families rather than trying to build their skills. Working to cultivate relationships among families. And that's where support groups come in. Focus on building their strengths and their resilience, and focus on empowering families, and focus on engaging them across all those multiple transitions and settings that they're going to find themselves in. Because if the resiliency is there, you can never predict what's coming down the road.
Right.
You know you can meet it.
Brad, I just want to say thank you so much for sharing that, and certainly sharing that testimonial. Again, having 3 daughters, that I'll just leave it at this blanket statement that at times have struggled with this content that you're talking about. And so I'd like to do, if there are some parents that are watching right now, or if you're watching the replay, what are some frequently asked questions that you get, maybe your top 2 or 3, just so parents know of why they should use the Parent Link, so they realize what a resource they have at their disposal. Maybe you give us some of those top FAQs.
Sure. And it really spans the gamut, but it does start with things like, why is my child behaving this way? We're getting a divorce. Can you help us not screw up our kid?
Wow.
We have people, calling in for car seats. Can you help us get a car seat? We can't afford one. And the thing is with Parent Link, we can probably get you that car seat that you could get yourself, but we can do it maybe in, a few hours rather than 2 or 3 weeks. We have people asking about all sorts of questions and things about, should I be concerned with this? And it's just great to have that person from, you're not being outsourced. This is somebody in your own state that you're talking to who probably has some similar life experiences.
Absolutely. And, you know, are there any other, success stories that you'd like to share that, has been a direct result of someone using the ParentLink resources?
One of the challenges is that oftentimes we don't get the follow-up. And so it leaves you hanging because, our specialists are working with these families over a
Right.
course of even months or sometimes years. And then you don't know what happened because everything's okay now. They don't need you.
Yeah.
And that's a success. But at the same time, you really want to know the rest of the story. I will share, though, that letter I read from,
Yeah.
that came in this morning.
Oh, wow. That is cool. Kind of eerie cool, right? I mean, you got this podcast tonight, your first time doing this, right? And here you go, you get this testimonial. Oh, those words are so rich. And I just hope that as you get more of those things, that you actually find a place, on your website or on the resource where you can share those. I think it's really important for people to know that there's hope out there. And certainly ParentLink is a great resource for
Well,
parents to go to. Go ahead, Lisa.
I think it goes to show we're not alone. Like, I'm a
Right.
mom of 5 kids, 2 who are adopted,
Yeah.
and have some junk in the trunk, and we are not alone. And I think that's that warm line. Like,
Yeah.
as you're talking, I'm like, man, I should have called them a couple of times, like, to say, hey, is this okay?
Well, and like Lisa mentioned earlier, that caring adult, it's about relationships, and
Right.
nobody is more influential in the lives of that young person than that caregiver or that parent.
Yeah, I'm just going to say that, something I hear kind of frequently is, my kid forgot to bring her medication to school and now she's without her meds. What do I do? Would this be an application of using ParentLink?
Absolutely.
Yeah.
And we have sometimes some situations where a parent might move to a new school district and there's some
Right.
problems, or there's a teacher, a professional having issues, and how do we have that awkward conversation of this kid who comes to school and they haven't bathed in a few days, or
Right.
dad dropped off the kids at the circle and the kids are on time, but dad was smoking weed in the car and now the kids have a contact high and no one knows it.
Wow. Wow. Brad, I just want to say we thank you so much for your work and your contributions, and certainly being the director of ParentLink. We want to thank you for being on this podcast this evening.
Thanks for having me, and thanks for this great work you're doing.
Thank you. Again, I'm going to be reaching out to you, just letting you know.
Perfect.
All right. See you, my friend.
Guy, you got your things all set up for the next, you're good.
Well, I'm good. I'm happy because you know what? Like, these could just be individual things. And the other thing is it ties into the Missouri Healthy Schools success stories that we do once a month with our videos. And again, there might be some great success stories just, sitting here where we might be able to unpack that, related to a resource. We've never done that before. Obviously, we always focus on what goes on in schools, but you never know, because again, this has been a big learning night for all of us, as we're really bringing a great context to these resources. And that's why I love all the guests you bring. We got just 2 more remaining. So let's finish out. And our next guest, and she's going to be talking on the topic of the most CPAP schools. And that's going to
we have one before them.
Oh, yeah, I missed it. Oh, yeah. How about that?
And this one I'm super excited about, because whenever I found, before you introduced her, I just want to say, this is one of those resources that whenever I found out about it, anybody that I talked to, I was like, hey, have you heard about this? And they'd be like, no, what is it? And then I'd tell them a little bit, and I'd say, hey, have you heard about this? And then I called my children's school. I'm like, hey, have you heard about this? And it's a resource that as a parent, for those parents that are out there, that you can use as well. So anyhow, without further ado, your turn, Guy.
All right. Well, let's bring her on. And that is going to be Michaela Geiger. Did I say it right?
You did, yes. Thanks for having me so much. Yeah, you did a phenomenal job. I know it's a hard one for sure.
Oh, Michaela, again, a great resource. I had a chance to talk to you, obviously, a little bit before the broadcast started, and you're doing some great work. And why don't you give us a little bit about our viewers, about your background and the great work that you're doing and leading into this resource?
Yeah, definitely. So I sit here with you today representing 33 community behavioral health providers that are actually the ones that house these youth behavioral health liaisons. And so we are just so fortunate at the council that we can be a small piece to this puzzle. So I come from you to you from the council, but my direct care experience was with all those community behavioral health providers. So I actually got to have the honor to work with these kiddos in that school setting and those families as well. And so now I just get to help all those great people that are doing that boots on the ground work and supporting them support our youth today and those families. And so the youth behavioral health liaisons have been live since July of last year. And so it is a newer initiative, but it is statewide, and it's so unique to our provider system. Our providers have been doing a great job in terms of school mental health and making sure that they're getting into the schools. But this youth behavioral health liaison role has just added an extra layer to our crisis continuum and meeting that family and that youth where they are. And so to talk a little bit about what that role looks like, schools have been leading the way at 32% of the referrals into this program. We've received over 1,000 referrals into the program since go live in July. So it blows my mind every time I get to report on that number of all the different youth that we are touching in the state of Missouri. But the youth behavioral health liaisons are really focusing on building relationships with all community partners that have touched youth or are serve youth in their referral and stakeholder place. And so that can be a juvenile officer, just a family member, a parent can call, as well as children's division, schools like I mentioned before,
Right.
courts, and then anybody. It's supposed to be a resource to meet that family and that kiddo anywhere, and also be able to come on scene, whether that is at the house, whether that's in the school, whether that is Walmart. I mean, they are there to respond and be that source. And they will connect them to the community behavioral health provider for long-term services if that's what they're needing, or if they're needing to be connected to other community resources, they will provide that as well.
So, Michaela, talk to us a little bit more about that relationship building piece, because again, I think that's something that really sets this program apart from others that are out there.
Yeah, definitely. That is a huge piece that we've received feedback on, that schools and other stakeholders have said, thank you so much. We've learned so much about
Yeah.
behavioral health. And so the YIBL is not just there to be that connection, but they're also there to support all these referral sources and answering those general behavioral health questions, information about diagnoses. I mean, they are there to kind of be the hub of all these great answers. And if they don't have it, they have the community behavioral health provider behind them to get those answers to those questions for them.
Yeah, and so my follow-up question would be similar to the question that I asked, Brad on Parent Link. Kind of give us an FAQ, maybe again your top 2 or 3 FAQs, so that maybe again parents that are watching would know exactly how this resource could be very beneficial to them.
Yeah, I mean, there's a lot of ways that you can go about it. I know that you pulled up our website. You can reach the point of contact for each youth behavioral health liaison and what county they cover on the Missouri Behavioral Health Council website, as well as the Department of Mental Health's website. And so you can call because you're all of a sudden your kiddo or your student is showing an increase in behaviors, and you just want to make sure that you're getting ahead of it and looping in the family and looping in all these other support systems. So it does serve as a preventative. There is that piece to it. But say it has escalated and your kiddo lets you know that they are thinking about harming themselves. And so then the school or the family or whoever that referral source can be can outreach their liaison and let them know the situation, and they can respond and try to do that safety plan and talk with that kid on de-escalation to get them to where they need to be, because every life, it matters and every life is important. And so they do both prevention and crisis. So if you are hesitating to reach out, go ahead and reach out. They're there for you, no matter what kind of involvement you have with that youth or you are that youth.
Right. I also saw that on the website, and I'll just bring it back one last time. But like you said at the very bottom, there's a Get Help Now button which again, if
Yes.
you need it, it's there. I think it's great. It's very highlighted. Obviously, it's in yellow, makes it very easy for people to see. Um, and so my last question is going to be this. What has been the impact, if you can talk about any of the relationship pieces that have developed, and what are some of the outcomes maybe that you've all seen?
Yeah, well, I can give you a professional relationship. Lisa and I have grown very close because of this program. So I'm so fortunate for that. It's definitely got us to grow our statewide partnerships and collaboration. But if I can, I actually also pulled up a success story that we received, and it was actually highlighted in Governor Parsons' State of State address.
Oh,
So we're
wow.
super excited about this. Our Yibbles are getting out there. They're doing the great work. And so this actually comes from a parent. It says, I want to let you know she has made a big impact in one visit. My daughter finally felt she was speaking to someone she trusted. She opened up more to her than anyone she ever had. She didn't appear to be rushed, and she expended her time with her, no questions asked. She is nothing short of amazing. And so I think that small quote from that parent just tells you that they're out there and they're amazing. They come from very different walks of life, whether that's professionally or personally. And I remember my first meeting with all the Yibbles being in one room instead of in these Zoom boxes. And it was very emotional just to kind of hear where they come from and their passion, and also just the kids that they've served in this short amount of time. It gives you goosebumps for sure.
What you just read gave me goosebumps. What are you talking about? I just, I just love the fact that we're progressing so much more. And again, I don't live in your world per se. I just report a lot of news, and I get to interview a lot of, professionals like you. What I find fascinating now, just hearing the stories tonight, is just that real relationship level, which COVID made very hard for everybody, right? Relationships. And now it just seems like here in Missouri, we're really, building that relationship and that foundation. And like you said, the thing that the parents said, they saw, what did they see? They saw that trust. And that's exactly what we're all talking about tonight, and about all these resources. So Michaela, thank you so much for being here tonight. We so appreciate everything you had to share. And yes, I got your contact info. So if you hear from me, you might be on a future podcast.
I appreciate it. Thank you guys so much.
Thank you. Lisa, so you gotten pretty close to her, huh?
Yeah. Well, like I said, I have 5 kids, so you better believe the first time that we talked, I was like, so tell me more. So what's the name of the Yibble that's for my county and where I live?
Yeah. Exactly. So, all right, we're at our last resource, certainly not least, but we're going to be talking about the Missouri CPAP schools, and we're going to bring on Dr. Melissa Morris. And I hope I said that right, because I do not have my word. Did I say it right?
Maris.
You know what? I knew that because of the baseball player. Yes.
Totally okay.
Oh, Dr. Maris. See, now I'll never forget that. So that's the good news. The bad news is, obviously, when people watch the replay, they'll see the mess up. But then again, I never said I was perfect. So
there we go. Nobody is, Guy. Nobody is.
So talk to us about, a little bit about your background and certainly the amazing work that you're doing.
I appreciate that. And I just have to say, this has been so much fun just to watch. I've been in Missouri doing school mental health work for the last 15 years in lots of different capacities. Most CPAP schools is actually a relatively new project, but it's just thrilling to see all of these resources and the collaboration across these friends, folks who are, focusing on parents and caregivers and, delivering, more primary prevention kind of work in schools is just thrilling. But so I'm a clinical community psychologist. I've been, again, in Missouri for the last 15 years doing school mental health work. And we are so excited with the launch of Most CPAP Schools. Most CPAP Schools is a consultation line geared towards supporting school professionals in building effective school mental health programs. The idea, and we kind of saw it tonight, is that, schools have, fortunately, a lot of resources, and building school mental health programs, effective school mental health programs, is very challenging. What I say is if you've seen one school mental health program, you've seen one school mental health program. They're all so different, and school districts are so different across the state. What we know is that depending on where you are in the state, you may or may not have great access to children's mental health support. And what we also know is that depending on where you are geographically as a school district, you may or may not be able to access high quality technical assistance to build and strengthen your school mental health program. And we don't think that's okay with most CPAP schools. And so that's really the vision, is the idea that no matter where a school district is in a state, no matter where a school counselor or a school nurse is working, whether they're working in a big district or a small district, if they're working close to St. Louis or Kansas City or Columbia or Springfield or not, that they can reach out and ask us questions about school mental health. And that what we will do is then do what we can to try to connect the dots across these kinds of supports. So exactly what Lisa was talking about at the top of the podcast today is that, a lot of our school mental health programs, a lot of our school districts, even in response to some of this amazing and innovative funding that DESE is rolling out, some of our school district friends really, they have a plan in place. They know what to do. They know how to respond, and some of them don't. And so the idea is that where do you go if you have questions? Who do you ask if you say, hey, right, this is the third time I've heard about ParentLink, but I'm still not sure I understand. Right. And so that's what we're there for, is so that school administrators, school mental health professionals, school nurses can reach out and just say, hey, I've got a question. So it's very similar to what Brad was talking about with ParentLink, but we're really focusing on school professionals as the audience, and just recognizing that school mental health is hard. It's tricky, it's complicated, and it's different all across the state. Right. We shouldn't expect school professionals who were not trained to be school mental health professionals to understand how all of this works. Been doing it for a while, and I often don't understand how it works. I'm just really fortunate to have a lot of really nice, smart people I can ask for help, and then we kind of figure it out. So we're trying to extend that work to school districts across the state.
So with that, I want to ask the same question I've asked our last two guests, and that is, again, here's the website on the most CPAP schools. Again, what are some of the top frequently asked questions? Again, so we can add value to someone who's maybe watching right now live, or certainly watching the replay, on how this resource can be utilized.
Yeah, absolutely. And so we are a relatively new project. We've been funded for a little bit less than a year. And so we are in a limited number of school districts right now. What I will say is that the types of questions that we get really vary. We got an email from a school counselor from a very small district in Southeast Missouri today, a school counselor saying, I need some new and updated resources on ADHD. It would be great if you could send me a variety, because the teachers I'm working with, some want a deep dive and some want, the tweet length. Can we have kind of an array, a menu? So that's what our consultants responded with, is kind of, here's a deep dive, here's a little something here, here's a website to find more. And sending that piece out. We also can support school professionals in how they're responding when they're working with individual children. So, right, schools are doing an amazing job, doing so many things. But where does a school professional turn once they've kind of exhausted their toolbox?
Right.
Like, we're not really sure what else to do, and then they can reach out to us, and we can say, well, hey, this all sounds great. What about this? Does your district have a good relationship with your YIBL? Check. Awesome. Do they know about 988? Is that on the website? Okay. Let's talk about ParentLink. Let's go through those pieces all the way to, so you're looking for a therapy resource. We have a full-time care coordinator who can work with school professionals to connect, to help those school professionals connect parents and families to therapy resources, and not just therapy resources, but whatever the resource is. And that might look different depending on, where we are around the state. That might mean talking to our friends over at ParentLink or 988 or all of these different resources that we've had on tonight. Part of it is just having a big problem-solving team at the state level, where we can say, okay, here's a tricky situation. We haven't run into this yet. Kind of how do we do this work so that we're not leaving our school professionals to try to figure this out on their own, which is a really hard place to be. If you're the only school counselor or the only school nurse, right? Or if you're a new school administrator and you're just trying to figure things out, how in the world would we expect those friends to know how to navigate these incredibly complex systems? We're here to help. We really literally are the phone a friend for folks who are working in schools trying to do this good work.
Wow.
Okay, so I'm going to interrupt real quick. I bet Guy has a question for you, but I want you to talk just real quick about the original Mo CPAP before the schools part too, because whenever I heard about that part, I was like, hey, my doctor,
right?
Children. So
I love it. No, I appreciate it, Lisa. So Mo CPAP, where does the name come from? So Mo CPAP is the Missouri Child Psychiatry Access Project. Now that we're in schools, we added schools to the end. But Mo CPAP started, and we've been in place for about 5.5, 6 years as a resource to increase psychiatry access for primary care docs. And so primary care providers, so really a variety, pediatricians, nurse practitioners, all totally free. So is Mo CPAP schools, but primary care providers can enroll in Mo CPAP and then seek and receive same-day consultations with a child and adolescent psychiatrist. In school mental health and in children's mental health, we sometimes kind of talk about how child and adolescent psychiatrists are kind of like the unicorns. Like we've all heard about them, but we're not really sure if they actually exist, because part of it is that there's so few child and adolescent psychiatrists. We're incredibly under-resourced in terms of our children's mental health workforce across the board in our state, but particularly with child and adolescent psychiatry. So in this place, if I want to take my child, if I have a mental health concern and I take my child to my daughter's pediatrician, we know that about 75% of children with mental health challenges first present in primary care. And so if I take my child to their primary care provider, and maybe it's a tricky issue, maybe my child has a physical health condition that makes treating them a little bit more challenging, maybe that primary care provider would be able to help me connect with resources or figure out a medication option if that's the way to go. But they just have questions. They can call a child and adolescent psychiatrist that day and have a conversation with them and say, hey, here's what we're running into, rather than referring out and being on a wait list for 6 to 9 months to try to get the same question asked. So with Mo CPAP, we have the on kind of same day psychiatric consultation. We also have a care coordinator for Mo CPAP as well, who can help those primary care providers actually connect families with resources. And for both programs with schools and in primary care, we do a lot of education, a lot of resources that are available online. Again, this idea that primary care providers are an incredible resource. They're an incredible resource in school mental health that I think sometimes we forget about. Of course, primary care makes sense. That's going to be the foundation of good health, right? Is kind of having that primary care provider, and with just being able to just kind of check in with someone and saying, hey, this is what I was thinking. Is that along the right lines? And the psychiatrists say, yes, absolutely. Or they say, let's take a different turn, and you really do need to get this young person into psychiatric care. Let's connect you with someone who can actually field that, so that you're not on a wait list for half a year. That's 6 to 9 months is almost an entire school year. Think about the learning loss that happens just while you're sitting on a wait list. And so we're trying to circumvent that situation.
So Melissa, my question for you is, obviously being a newer program, what are your top, goals and objectives for the program, and where do you see it maybe in the next 2 to 4 or 5 years?
I love that question. Part of it is because even though Mo CPAP schools, kind of formally is pretty new, this idea has been evolving among the state groups that are involved in school mental health for as long as I've been doing the work. And so we are really fortunate in Missouri to have amazing state agency partners and also school professional partners. So our school counselor organization and our school administrators group, and these folks who have been talking about this work for a long time with kind of this focus that we have with Mo CPAP schools, that everybody in a school should be able to reach out and ask a question. We don't want our teachers or our special educators or our principals encountering a situation and thinking, I'm not sure what to do here. When it comes to children's mental health, we should all be able to reach out and ask somebody for help. And so in many ways, this work has been evolving. We were just, kind of lucky to be in the right place at the right time to be able to capitalize on it. But I think really, our primary focus right now is reaching counties that have the greatest health disparities. We know that health equity, just like educational equity, is a thing in our state.
Right.
So we're focusing on parts of the state where we were hit particularly hard by COVID. But then really the big term vision, 1 or 2 years, is that, again, every school district who wants to in the state, that school professionals can reach out and ask. I want that number that Lisa mentioned at the beginning for the responsive services grant. I want every school district to be able to access available funds and to be able to use those funds to do good stuff that can sustain, that can scale. Again, I don't think geography should determine whether or not a child can get into mental health supports and services. And I don't think that's where a school district is located should determine whether or not there are great supports there either. And so I think that's something we have to think about statewide, which is part of what's so exciting about so many of these resources you've had on tonight is that we do have that focus, right? That we're trying to kind of, statewide, making sure that folks have what they need to keep doing this good work.
Well, I just want to say thank you, Melissa, for being on tonight. Just stay where you're at, though. I'm not removing you from the broadcast.
Oh, okay. I'll be right here as long as you want to keep me here.
Because what I'd like to do now is I want to bring everyone back on. And, I cannot believe everyone has been hanging in the virtual green room. And let's go ahead and bring Lauren back.
Like the dream team.
Exactly. And let's go ahead. And I got to get to my second screen. Michaela. And bring Amy back. And I think I have everyone. And maybe just double check. Looks like that I do. And so what I would like to do at this time is, Lisa, you assembled this amazing dream team. And what I'd like you to do to kind of, end the broadcast is kind of just give us your closing thoughts. And because obviously here, what we have is a team approach, right? We're getting away from the silos here in Missouri. Obviously, look at this group of we have 6 of you that have all been working together in some capacity. And so kind of give us that final word, if you would, on tonight's broadcast.
Absolutely. So I think that, this opportunity, first of all, to say, hey, Lisa, do you want to do a podcast? First, the podcast isn't just audio. It's not just listening to people. Oh, it's video. And then, to bring this opportunity to us and then to be able to share it. Because people keep saying, oh, you're the expert. And I say, no. I just know some experts. And so let's bring the people to the table. And so, because we're not working in silos, we are a team, we are partners. And so we are doing this good work together for kids. And so kind of how we started it school level, that we have to come together, and that's what we're all about. So, I think this is the team. And I know everybody that's represented here has a team themselves that if Melissa was doing this podcast, she'd say, hey, I have these people, let's bring them on. If Lauren's doing this, everybody has their people. And so it's not just, this is my team. This is a statewide team for school-based mental health. So I feel like, we're all in this together, as they say. I'm not going to break out in chorus, but we're all in this together.
Well, I guess what I'd like to say, kind of to wrap this up and put a bow on it, it's really this simple. Each of you shared amazing resources. Obviously, mental health certainly is not going away, but it does seem, I'm going to quote the great Steve Jobs here, it does seem like Missouri mental health professionals and the team that's been part of tonight's podcast and others, of course, in Missouri, that we're putting our dent in the universe. And I got to tell you, between the relationships, the accessibility, the building trust, and just how easy it is to get to the resources, the fact that this podcast will be able to share out, just repurpose it. Even the segments by themselves can be repurposed, and also lends itself where we can even go do deeper dives on future podcasts and things like that. And I was not kidding when I said I would love to do at least one, if not two, on the move school success stories, of someone using the resources, of some amazing stories of how your resources are impacting kids and families' lives. And this is what this is about. And that's why I feel so blessed to do what I do in media. And this is my 5th year doing it. And I cannot be, more honored to say what an honor it is to be with all of you tonight, to hear the difference that you're making each and every day in this confusing world of mental health. And so I just want to say thank you to each of you for being on this podcast tonight. And with that, I know it's time to say goodbye. Just want to thank everyone for tuning in tonight's podcast. Again, the replay will be available sometime tomorrow right away. And like I said, you'll see a lot of repurposing of this. You'll see us putting out, and as far as Missouri Healthy Schools goes, we'll be using our Instagram as well as our Twitter, and we'll be putting out more information that we'll get from this great group of mental health professionals that we have. So we want to thank everyone for tuning in tonight on the MHS Podcast Live. I've been your host, Guy Danoff. I want to thank you for watching right here on MHS. Thank you and good night.